wanted to thank all the residents for participating today. We have years 1 through 5 all on all at the same time. So thank you very much. Very proud to be able to be involved in their education and part of the department. Today we would like to hear their opinions of the program. So you get to hear it from all different levels. But I think the first thing that I think is kind of an obvious question is, why did you choose this program when you went through the residency match process?
I interviewed all across the United States and just kind of felt drawn to this program in particular, basically because of the relationship that I saw that the residents and the faculty had, as well as the relationships between the residents themselves. We were privileged to have an interview dinner the night before, and just being able to see the residents interact with one another. They were basically just a huge family. And that really portrayed throughout the interview day itself. Everyone came in and introduced themselves. It was very casual. And I just had a good time throughout my entire interview day and could really see myself fitting in here. So I ranked it very highly.
I actually came and did an away rotation here as a fourth-year med student. One of my co-residents was a good friend of mine in med school, and he and his wife had matched here a year ahead of me. So I came and spent time in Oklahoma City for a month, and kind of like Tyler, I fell in love with the program. I fell in love with the people and the attendings, kind of the camaraderie and the autonomy that you get as a resident. But also I really enjoyed Oklahoma City. I wanted to live in a bigger city than where I'd lived previously, and it kind of checked all my boxes.
My first month, I started on our emergency general surgery service, which is kind of the acute care service, which is a team made of an intern, first year resident, or a 2, and then a chief resident. That's a lot of, appendectomies, cholecystectomies, hernia repairs. Then I moved on the following month to vascular surgery, which is a team comprised of first year resident and fourth year resident. And then I'm currently at the VA service right now, which is kind of a combination of both general surgery as well as vascular surgery. So far, my 3 months into this, I have really no complaints. I've been getting in OR a lot, which is great. I've been also just helping out the teams on the floors and just kind of learning how to take care of a patient.
The second year, I would think, is probably one of the hardest. You're getting more responsibility for the first time. You're still kind of an intern, so you still have to do a lot of the grunt work. But I think the great thing about second year is it's probably the first year that you really get to feel more comfortable in the OR, kind of like hone in a little bit of your skill there. So we do 2 months of emergency general surgery, which is kind of what Skaggs talked about, a lot of appies and cholecystectomies, and then 2 months of thoracic surgery, kind of getting to know that for the first time, with some critical care there, 2 months of ENT, and then 2 months of nights, and 2 months of the VA vascular and general surgery.
So for third year, it's pretty much kind of being chief in the ICU, followed by you're doing a surgical oncology rotation, a colorectal surgery rotation. These are both kind of comprising having a fifth year teaching you the operations and having you kind of be more of an independent surgeon, but also learning how to make up your own plans a lot more definitively than I think the other years before. We have also the Edmond rotation, where we go to Edmond, Oklahoma, and it's kind of more of a private hospital type of rotation. And then we also go to Lawton this year, where we will do a rural rotation and kind of get a lot of more independent autonomy in doing operations there.
So our schedule is fourth year starts. We do a lot of trauma as fourth year surgery residents. We do 2 months as the trauma day chief, 2 months as trauma night chief, and then we move on to thoracic surgery, then vascular surgery, transplant surgery, and then we do 2 months outside at our community hospital in Edmond, learning to do more outpatient elective surgery.
So for our chief year, our fifth year, most of the year we spend 8 months out of the year at our main hospital. We do 2 months on the surgical oncology team as the chief. We do 2 months on colorectal, 2 months as the emergency general surgery chief, and 2 months on our minimally invasive service with Dr. Fisher, who has a bariatric program, and she also does some foregut cancer surgeries. And then we spend 4 months at the VA, 2 of which you're the general surgery chief and 2 of which you're the vascular surgery chief. So throughout the year, you're really stepping into your role as chief and making decisions, managing your team. For the most part, we get to make a lot of those decisions, run them by our attendings, but a lot of times it's based on what our decision is as far as managing our patients.
I think my relationship with the attendings I've met so far has been great, and that was part of the reason I ranked here quite highly, because I got to talk with the residents at the dinner, and they all emphasized that they have great relationships with their attendings and their chief residents. And it's been my experience for the past 3 months that that is completely true. I've enjoyed working with all the attendings. They're all very approachable. I get to text some of them just with issues. I text my chiefs directly, and we all communicate pretty equally.
Obviously, being the only level 1 center in the state, we get a lot of trauma experience. And like Jackie was saying, in your 4th year, when you're the trauma chief, you're getting a lot of experience in the operating room, but also you get experience making decisions for those patients, decisions as far as getting CT scans, how to manage those patients, if they need to go to the operating room or not. And our attendings that are our trauma attendings are really good about putting you in that situation where you have to make that decision, not just telling us what to do. And I think they're awesome at teaching us everything we need to know as far as managing trauma.
As the state's only NCI designated cancer center, we get referrals from all over the state. So we get a wide variety and wide breadth of cases. We have experts from that trained in their discipline in multiple well-renowned, renowned places throughout the United States. And they give us not only autonomy in clinic and help us walk through their decision making, and we have tumor boards that help us understand clinical decision making when it comes to complex oncologic cases, but also we get a lot of autonomy in the OR and complex cases with multiple teams involved. It's great experience and cases that you can only get at a high-powered academic center.
I think the biggest thing is that there's a lot of resources available to us. No matter what fellowship we're interested in pursuing, there's opportunities for research. Dr. Morris, who is heavily involved with our research division, is always available to us, as well as a team of biostatisticians and epidemiologists to help us with our research projects. For a lot of competitive fellowships, having some sort of research is key. And our program here definitely sets you up to have those things available to you just with a simple phone call or email. I think that's a big part of it. I have some things in mind, and research is always available for me to be able to hopefully reach those goals someday. I think that's a big part of getting ready for what I want to do in the future.
Yeah, I just think that the breadth of the pathology that we see at OU as compared to other hospitals across the state and the country is something that speaks for itself. We not only learn to become just basic general surgeons as far as operating comfortably in all kinds of environments, but we also take care of such complex pathology in our surgical oncology service and colorectal service and pediatrics that we can feel comfortable doing pretty much anything. If we can operate at that high level of complexity, then we feel very comfortable doing basic things that we would be expected to know as soon as we start practice in general surgery. And I think that we have enough people that have graduated from this residency and gone straight into general surgery and have very successful careers after that because of the training that they get just from their 5 years of residency here.
During your first year, you have kind of other surgical services who are participating in some of the rotations you do. And already I've made friends with people in urology and orthopedics and things like that. And I can see, kind of the classes above us that they still keep those friendships. So from, everyone in the residency gets along, everyone, co-residents, we all kind of hang out, from 1s to 5s. But then outside of just the Department of Surgery, I've seen people, hang out and, in the hospital, outside of the hospital with other departments as well.
So I think something that's unique to OU program is having so many different entities located within a small geographic space. I mean, here we have what we call the old Presbyterian Tower, which is the original hospital, but we were also accompanied by the state's only children's hospital, the NCI designated cancer center, that is Stevenson. We also have our outpatient surgery center, the VA, as well as Harold Ham Diabetes Center, an allergy center, the College of Public Health, the College of Nursing. So we have so many different things all within one little area, and we were able to participate in all these different locations. Having the med school here as well, we get to work with medical students, and then we're also working with the vets, working at the pediatric hospital, doing cases and procedures over there. And then we also have our brand new bed tower, which is going to, I don't know if this exactly doubles our capacity, but we have at least quite a few more ORs and more patient beds added to our overall capacity. I think that's pretty unique. I know other places I went, you had to travel quite a bit distance to get these things, where we're able to do this all within a walk, and they're all connected by bridges and tunnels. It makes it easy for us to get involved in lots of different areas.
Something unique about our program that I think I've realized even more in my role as a fourth year and fifth year when we're in the chief position is the lack of fellows that we have here allows us as residents to be doing fellow level cases a lot of the time, especially as far as vascular surgery goes and surgery. I was helping my attending and at some point doing the main part of the case with major vascular cases and astomies, thoracotomies. And then as far as in trauma procedures, you're the main resident operating. And sometimes when there's multiple rooms going, your attending's bouncing back and forth. So I think having the only fellows that we have are pediatric surgery fellows. And I think that gives us really good operative experience in all of our other rotations.